What is the risk assessment in crisis intervention? Have you ever wondered how professionals handle a crisis involving substance abuse? Understanding risk assessment in crisis intervention is key to ensuring safety and support. So, what does this process involve? Risk assessment is a vital step in crisis intervention, especially when dealing with substance abuse and addictions. It helps identify immediate dangers to the individual or others. The goal is to evaluate the severity of the crisis and determine the best interventions to ensure safety and stability. First, let's clarify what crisis intervention means. It refers to the immediate strategies and support used to manage acute situations arising from substance abuse. The aim is to stabilize the individual's condition and set the groundwork for long-term recovery. Now, what does risk assessment entail? It involves quickly evaluating the individual's mental, physical, and emotional state. This helps identify any life-threatening conditions or immediate risks. A key part of this assessment is distinguishing between suicidal intent and nonsuicidal self-injury. This distinction is crucial for deciding the right response. One of the main components of risk assessment is assessing intention. It is important to understand whether the individual intends to end their life or is seeking relief from emotional pain. This understanding helps tailor the interventions effectively. Another important aspect is identifying protective factors. Recognizing positive coping mechanisms, support systems, and behaviors can help reduce the likelihood of harmful actions. More protective factors generally mean a lower risk of engaging in dangerous behaviors. Establishing a connection with the individual is also vital. Building trust and rapport allows for effective communication and creates a supportive environment. This connection can make a significant difference in the intervention process. Ensuring safety is a primary goal of risk assessment. Addressing immediate risks, such as potential self-harm or harm to others, is essential. This may involve creating a safe space and taking necessary precautions to protect everyone involved. In the context of substance abuse, risk assessment is especially important. Individuals may show symptoms that mimic psychiatric illnesses due to their substance use. A rapid assessment can help identify these cases and ensure timely intervention. Quickly evaluating the individual's mental and physical state is crucial. This helps determine the severity of the crisis and whether immediate medical or psychiatric intervention is needed. Engagement strategies also play a role in crisis intervention. Identifying the person's goals and requests for help can establish a connection and reinforce hope. This is important for engaging them in the recovery process. Effective crisis intervention not only stabilizes the individual but also sets the stage for long-term recovery. By integrating these components into crisis intervention strategies, individuals struggling with substance abuse can receive the immediate support they need while being guided toward a path of recovery.